Yeah, sure.
Yeah. So, welcome to today's session by Dr. Medha Joshi. She is one of the pioneers of medical education in our country. She is MHP from UIC, that is Chicago, and she also has worked a long time in Ramaya in the head of the education department. She is IFME fellow. Thereby, she has done her UIC, and we all learned from her and learning from her still. I think by and by you will come to know the quality of her sessions. So please pay attention, take down notes. Madam is very particular in asking you questions and giving you assignments. So enjoy the session today. Over to you, madam.
Thank you, Dr. Suhasini, for the introduction. And maybe I may not be able to see you all, but can you just briefly introduce each one of you, your name and from which college you have coming from, which department also?
Good evening, madam. I'm Dr. Narendra Padiyar.
Uh-huh.
I'm currently working as a principal in Mahatma Gandhi Dental College in Jaipur.
Jaipur. Oh, okay.
Madam, could you see him?
No, I can't see him because I made it full screen. I can't see him. Maybe at
No,
the end of it, I'll.
on the right
Uh-huh.
side of your
Nothing.
window, there is a
Nothing.
square, a dotted square. Click on that. On the right side down. On the right side.
Right side down.
Or maybe below the screen.
Uh-uh.
There is a square.
No, I'm not able to do that.
Okay, madam.
Maybe I
Okay.
will see it later once the session is over. In
Yeah,
between, we
yeah.
can see.
Yeah, we can then make it into off screen mode. Then
Yeah.
you can see everyone.
See, yeah.
Yeah, Narendra. Then,
Next one.
Ma'am, good evening, ma'am. I'm Dr. Meenakshi from JSS Dental College, Mysore, ma'am.
Mysore. Okay.
Mysore, ma'am.
I'm Lieutenant Colonel Arun Kumar KV from Army Dental Center, R&R, New Delhi, ma'am.
Okay.
Good evening, ma'am. My name is
Good
Shilpa
evening.
Sinodda.
Uh-huh.
I'm from Malbadar Dental College, Gulbarga.
Gulbarga. Okay.
Yes.
Yeah, good evening, ma'am. This is Dr. Rohit Kumar
Mm-hmm.
from ESI Dental College, Rohini, Delhi. Sir.
Okay. Hmm. Or that's all? Or any more? How many? Only four, 5 people are there?
No, ma'am. Actually, there are more people.
Uh-huh.
Uh,
We are 10 people.
10. Then I heard only 5 of you.
um,
Yes.
duties 1, 2, 3, 4, 5, 6. Currently, we are 6 of us, ma'am. Online 1, 2,
Okay.
3.
Okay.
Oh.
So shall we start? Dr. Swatini, shall we start?
Yes, ma'am. Let's
Yes, ma'am.
start
yes,
your
madam.
details.
Yes, madam.
Okay.
Yes, madam.
Okay. So you have been dealing with different aspects of assessment so far. And I think last week you had a session on multiple choice questions and item analysis also. So today we will see something about formulating effective free response type of questions, right? So can Somebody read this? Can one of you read the question here?
मैम इट्स आजादी की लड़ाई में बापूजी का कितना बड़ा हाथ था?
And the answer
So
is
that boy wrote that इतना बड़ा.
इतना बड़ा था, right? So
Yes, yes.
this is a free response. So when you ask questions like that, you will get answers the way you ask the question. And the second example is asking you to find X in this diagram. So the answer you get is, here it is. You can just click on it and say this is the X. So what is the problem with both these questions? Do you think there is any problem or they are okay?
The question is not specific.
Questions are not very specific, so you can get any kind of answers, right? So the purpose of today's session, or the agenda for the today's session, is that by the end of this session, you should all be able to describe the different types of free response type of questions, the advantages, limitations of these types, describe the advantages and limitations of essay type of questions, and formulate effective essay questions, and discuss the methods to improve the validity and objectivity of essay type of questions. So today we will be dealing only mainly with essay questions, and in the next session we'll look at the other type of free response questions. So can you tell me, what do you understand by the term free response or construction type, and selection type or supply type questions? Can one of you tell me what exactly you understand when I say free response type?
Uh,
Open-ended type of question. The student can write anything.
No, your voice is not heard properly. Can you talk a little loudly or come closer to the microphone?
Yeah, free open-ended type of question where the student can answer anything, write down
Okay.
anything related to the
Right.
topic. But in
Okay.
selection type, we are giving the choices. So among the choices, we have to pick one.
Okay. Anybody else wants to add anything to this free response or construction type of questions?
the student has an opportunity to express his own thought process in answering the question, having a customized structure as per as his understanding.
Yeah. So basically, he's constructing the answer, right?
Yes.
You're asking him a question and giving him an opportunity to construct the answer. Whereas in the selection type, what happens in
The
selection or a supply type?
responses are already given, and we are just
So he just have to choose
yes.
between the thing. Okay, so now can you identify which are these MCQs are what type of questions?
Selection type.
Selection.
MEQ?
Selection type.
Anybody else? What does MEQ stand for?
MEQ means
What does MEQ stand for?
Multiple explanatory questions.
It is modified essay question.
Okay, modified as.
So if it's a modified essay question, where would you put that under?
that's free response.
Free response.
Free response type. Fill in the blanks.
Free response.
Fill in the blanks would be selection or a free response.
Selection.
In the fill in the blanks, do you give
Yeah.
them any? Do you supply with the answers?
No.
No, ma'am.
You don't supply with the answers. They have to put in the answers, right? So does that go into supply or construct?
Mm, construct.
It would go into a construct. Though at the very low level, it would still go into a construction type of question. Matching questions.
Supply.
Match the following supply questions.
Supply.
Yes. True or false?
Construct.
Constructive.
Why do you think true or false is construct? You are giving them
Yeah.
answers and asking them whether it's true or false.
But they have to think, no, ma'am.
Yeah, they have to think. Even in MCQ, they have to think, no?
Selection type.
Selection type
Yeah,
with only two choices are given.
yeah, only two choices are given. It's a selection type only. Either it's true or false, 50-50%. Whereas in multiple choice, you are giving them 3 or 4 options and they have to pick up one. Isn't it? You all
Yes,
agree
ma'am.
with me that true or false is also
ma'am.
a supply type?
Yes.
Yes.
Yes, okay.
Yes, ma'am.
Okay, and SAQs? What does SAQ stand for?
Short answer question.
Short answer questions. And where do they fall into?
Constructive.
They fall into construction. So we are very clear about what is supply and what is a construction type. Now, when we say an essay, whether it's a long essay or whether it's a short essay or it's a modified essay, what exactly does an essay mean? No, it's a French word actually, SI. SI means attempt or to
Okay.
try. So it is an attempt. It's the person is attempting to communicate something with you through the answer. And what do they communicate? They try to communicate some information, their opinions, they try to communicate their feelings, or they communicate their argument to for or against whatever question you are given. So essays could be of different varieties of types, right? So what exactly is the essay type of question? You can maybe define it as it's a tool that requires examinee to compose a response, usually in the form of sentences of a nature that accuracy and quality of which is judged subjectively by the informed or skilled subject, right? So the important thing is that they put in accurately, they compose an answer which is accurate and of good quality and which is judged usually subjectively. This was in 1951, that was the definition that was given of a essay type of question where there is a lot of subjectivity, which is when it has been marked by an informed or a skilled subject expert. Okay, so we can divide the types of essay questions into basically 4 types. Long essay questions, or sometimes they are called as long answer questions also, LAQs. Short essay questions, short answer questions, and modified essay questions. Now, of these, which of these you're familiar with?
All of them except modified essay questions.
So you're all familiar with the first 3 except modified essay questions. Okay. Now, here is a table where RGUHS, that is Rajiv Gandhi University of Medical Sciences. I come from Bangalore, so I'm taking an example of Rajiv Gandhi University, where the pattern of examination is we have a long essay for 2 questions, long essays. The time that is calculated is 20 to 25 minutes per question, and the marks that are given per question is about 10 marks per question. And then you have short essay questions. which are about 6 in a number, and marks vary between 5 to 8, and time is 5 to 8 minutes, and marks given are 5 per essay. And short answers are really short, so that we expect the students to answer them in 1 to 2 minutes, and they get only 2 marks of it, and usually it is the t- 10 questions are given in it. So this is the distribution of question papers or questions in the question paper in RGUHS. Now, I was teaching in an international medical school where the pattern was slightly different, where we had modified essays or MEQs as the main questions, where there used to be 2 MEQs of 20 marks each, 10 marks, 20 minutes each, and 10 marks per question. Then we had short essay questions, which were also 2 in number, and they carried 10 marks each. And then we had MCQ. Major chunk of the thing was MCQs, which is 60. Somebody's mic is on. Can we have all the other mics off, please? Thank you.
Madam, you are muted.
Medha madam? Dr. Medha?
Yes.
Madam, we missed you for some time.
Huh?
We missed you because
when I asked everybody to mute themselves, I think I was also muted. So that was
Okay.
problem. No issues, I think. I have to start the screen sharing all over again? Is it? Is my
Yes, ma'am.
screen visible?
Yes, ma'am.
Full screen?
Yes, ma'am. It is visible.
Okay, fine. So, is there a provision to have breakout rooms?
Yes. Yeah, how many? Two, no?
Yeah, we can have 2 groups.
Samik, B group karje.
That's what I thought. In Google's, you cannot have breakout rooms.
Yeah, we used to use the other web.
Zoom, Zoom.
Yeah, not Zoom. This year it was WebEx, but
Okay.
the WebEx expired, so we had to subscribe
Okay.
again. Yeah.
Okay. Okay, now maybe you all come from different universities, right? So you maybe just think, and then you can share it in the group directly. You don't have to go into different groups. Anyway, the number is not very big also. And then we can discuss the advantages and limitations of essay type of questions. So who will start? The doctor from Jaipur.
Yes, ma'am.
Yeah, can you share the composition of question paper in your university, please?
Yes, ma'am. It's a 70 marks question paper divided into 2 sections. Each section has got one main or one essay question, and which is 10 marks. And there's another option of short answers, that is 5 marks into 2 questions. And then sorry, ma'am, there's 2 essay questions of 10 marks, and then 2 short
Questions
short
of
essays of 5 marks. And we have 5 marks, 3 questions.
5 marks, 3 questions.
Yeah.
5 marks, 2 questions. 5 marks, 3 questions, and
3 questions, and there is a
10
choice.
marks to
There's
10
a
marks.
choice. There's a choice between the first 3.
I see.
Yeah.
So essays, both the essays, you have a choice.
Yeah.
Okay.
Only the short answers are compulsory. The 5 into 3 are compulsory.
5 into 3 are compulsory. So out of the top 3, they can answer any 2?
Any 2, yeah.
Oh,
in both
okay.
the sections. Yeah.
Okay. Doctor from Gulbarga? Kalburgi.
Yes, ma'am. Good evening,
Yeah.
ma'am.
Good evening.
Ma'am, it's Arjun just ma'am. Long essay, 2 in numbers, ma'am, which is 10 marks each.
Yeah.
And the short essay answers, they are 6 in number, 5 to 8 minutes and 5 marks each. And short answers, 10 questions.
You come under RGHS?
Yes, ma'am. RGHS.
Okay. So the question paper is similar to RGHS. JSS, you have your own
Yes.
system?
Yes, ma'am. Yes, ma'am.
Is there any difference between RGHS and JSS type of questions?
Ma'am, we have one main question actually, one main essay which is of 9 marks for internals. I'm talking with respect to internals, ma'am. And 5 marks each of essay short answers, which is of 3 questions, and 4 short answers, which is of 2 marks each. So total it will be 32. And we also give MCQs for 8 marks. So that comes up to 40 marks each.
8 marks?
8 marks, yes. Sorry, each question 1 mark, ma'am. So 8 questions, 8
only
marks.
8 questions. Okay.
Yes.
Okay.
Madam, if I may just add,
sure.
We have started from last year adding 10 questions for MCQ.
Okay.
The 5 in each section.
Okay.
Yeah.
Okay. Anybody else wants to share their university pattern?
Ma'am, I'm from Kerala.
Okay.
We follow this KUHS, Kerala University of Health Sciences. What we have is 2 essays, that is 10 marks. That comes to 20 marks. Then we have 4 short essays. So 4 into 5, 5 marks this thing. So that again is 20. Then we have 10 questions of 3 marks. That is short note. So
short essays.
Yes.
Okay. Short answer questions.
Short notes, ma'am.
You call it as short notes.
Yes.
Okay.
So long essay, short essay, and short note. So it comes to 70 marks, ma'am.
Okay. Can you tell me what is the difference between short essays and short notes?
Short notes is basically, ma'am, 1 or 2, maximum 3 sentences.
But you're giving them 3 marks, right?
Yes.
Okay.
3 marks it is, but in a very concise form. Whereas the rest will be similar to an essay, but in a short essay will be a short form of essay, ma'am. Short version of essay.
Short version of essay. Okay. Fine. Anybody else?
Ma'am, I am from Bhubaneswar, from Sikha Anushandhan University.
Okay.
In our case, that is in each section, 1 long question carrying 10 marks. Then 4 short essay type of question, each carrying 5 marks. Then 5 MCQ.
Okay.
Each carrying 1 mark.
1 mark. Fine. Somebody is from Delhi, right?
Ma'am, we have 2 long essays, which is 20 marks each, giving it to 40, and 6 short notes, 5 marks each.
Okay.
So it's a 70 marks paper, and remaining is Viva and the.
Fine. So what is common in all these papers is all of you have long essays, right? Whether it is 8 marks or 9 marks, everybody has long essays and everybody has short essays also. So can we look at what are the advantages of essay questions? Can each one of you tell me one advantage of essay giving students or assessing the students with essay type of questions?
Ma'am, it has got a deep understanding of the subject.
One at a time, please. Yeah. Can we go according to your roll numbers? You have sent the list, right? Let me just open up the. Yeah. In the meantime, you can start.
Ma'am, it can give an assessment of higher order of cognitive skills.
Okay. That is
Number two, ma'am. I am number two.
Arun.
Number one is not there.
Okay,
Arun.
Arun. Okay. Next is number Jyoti.
Number 3, ma'am, me.
You're number 3. Okay.
Yeah.
Mima.
The student is able to express his own idea regarding the subject in
Okay.
and express in his own words whatever he
Okay.
has understood.
Understood. Fine. Jyoti.
Ma'am, the advantage of the thing is it's you don't have much of the multiple select questions MCQ. So
No, no, we are
that is
not talking about disadvantages. We are talking only about what are the advantages of long essays.
long essay advantage. You'll know the person's knowledge, more knowledge, like deep knowledge regarding the question.
Okay, fine. You can assess the deeper knowledge. Then who is the next? Number 5. Siddharth. Siddharth, are you there? Yes. Do you think there are any more advantages of long essays?
Ma'am, express their ideas in their own words, ma'am.
Yeah, they can express their ideas in their own words. Okay. Then Shilpa, is she there?
Yes, ma'am.
Yeah.
Student can have a free hand to go into depth of the subject.
Okay. What else?
Madam, we can assess the understanding of concepts, then description of processes.
Okay. Is that Rohit Kumar?
Writing skills.
No,
Yes, ma'am. That is.
Okay.
And it was Naren sir. Ma'am, this is Dr. Rohit. Ma'am, what I think that through the long essay, we can check the development of critical thinking of any student, how much they can think.
Okay. And last, Dr. Sandhya.
Then they can form a structure. So that is one way of expressing.
Okay. So
categorize each thing and make it into a structure form.
Yeah, they can write it in a structured form. Fine. Now, in the same line, can we have one limitations of essay questions?
Madam, subjectivity in assessment.
Subjectivity in assessment, very good. Number 2. Next one.
Ma'am, difficult to limit the content.
Difficult to limit the content. Okay. Number 3.
Ma'am, it is time consuming.
Time consuming for what?
In expressing the ideas, ma'am. It's a long paper.
No, but long paper, you're giving them time, right? You're asking them questions pertaining to that particular time limit only. You're not going to ask them long ones.
Madam, it's a time limitation for the examiner. Burden.
Examiner. For assessment, it's time consuming. Okay. What else?
And biased assessment.
There could be a biased assessment. What do you mean by biased assessment?
Sometimes students write irrelevant answers related to the question. They just fill it up.
Okay, they may not write any relevant answers, just fill up the question papers. That reminds me of a thing when my college, we were associated with, Ramaya was associated with Bangalore Medical College. I remember one question paper. He started, one student started writing with he just first wrote the answer, question, what was asked, and then filled up the whole page with the names of Madhuri Dixit's movies, full list, and then again ended with writing this question again, you know. So it looked as if he has written the whole page, but it was full of Madhuri Dixit's pictures, names that were filled up there. So they can do all kind of things, sorts of things. Yeah. Any other limitations?
Handwriting, ma'am.
Yes,
Student
very important. If the handwriting is not good, difficult. Anything else?
student might go, yes ma'am, student might go out of context. There is
Okay.
a chance.
Okay. Right out of context. What else?
Madam, a limitation on the part of the examiner to examine number of um, copies in a particular time frame. If you are
Okay. So
forced
it's
to,
time consuming basically,
yeah,
isn't it? Yeah. Time consuming. Fine. Any
the
other?
examiner may not take it seriously because of lack of time.
Oh,
He may
lack
not
of
read it
time. Yeah.
carefully.
It may be done very superficially or things like that. So, any more limitations, or shall we have a look at what the
Ma'am,
literature says?
revision will be difficult if they wants to
Hmm?
check what is wrong. Sometimes after writing in exam, they were revising if some time is there.
Uh-huh.
For long essay, that revision will be difficult.
Difficult. Revision would be difficult. Okay.
Madam, one more disadvantage
Hmm.
is from experience. If it's
Hmm.
a 10 marks question and if the
Hmm.
student has written excellent,
Hmm.
no examiner will score it as 10 out of 10.
Correct.
It,
So there is
and
always a
yeah,
thing that how can we give him full marks even if he's written well,
yeah.
right?
Even
Okay.
short answer, nobody gives more than 4.
Four. That's a mindset of the examiner, that
Yeah, yeah.
not to give them full marks. Okay.
Yes,
That can be overcome by giving them MCQs, right? Different types of MCQs you can set up at that advantage.
yes, ma'am.
Okay.
Yes.
Any other limitations, or shall we proceed further? Okay. So here are the advantages that we saw. Uh, Yes, we can go to all levels. The way you frame your essay type of questions, has the ability to assess the recall. So all the different levels of your educational pyramid, right? You can start from levels of recall, understanding, reasoning, analysis. So you can basically use essay type of questions to assess the HOTS, or higher level of thinking or critical thinking questions, right? And it provides an insight into the writing ability of the student and ability to process the information what has been given. Now, those are the advantages, some of the advantages, and others you have already mentioned. So, what type of a question? We said it can, essay type of question can be of, it can ability to assess understanding and comprehension, or it can go to reasoning ability, or it can go to HOTS. So, what type of question is this? Can this be asked as a essay question in your paper, dental question?
It can be asked, madam, but
No.
the construction of the question is not as per long essay.
Why?
Um
More
of
specific,
course,
ma'am.
the student can write whatever he wants because
Yeah.
it is an
What are the hazards?
open-ended.
You're asking him what are the hazards of mercury. So he can write whatever hazards he knows, he can write, right?
Yeah, but it is not limited to dentistry or something like that. It's not
Yeah, it's
mentioned.
not. So it's not a very clearly thing and a clearly written question, and mainly it is at a level of recall only, right?
Yes, no, yes.
It doesn't go beyond that. The same thing you can modify maybe. What are the mercury hygiene practices to be adopted in a dental practice setting? Is this more structured, more
Yes.
specific?
Yes.
Yes.
And what level will it come for? If you look at, is it recall, understanding, comprehension, critical thinking, or higher order, HOTS, lots or HOTS?
It is not of the highest order, but it is slightly higher than the first question.
So it's a comprehension, you can say, or understanding, right?
Understanding.
Unless in understanding you can talk about. It's a little better structured question. The third would be international agencies are supporting phasing out of mercury from the dental establishment. Give reasons.
Analytical.
This would go at a HOTS, right? It's a better
Critical.
question. It's a high, it is actually assessing the critical thinking of the students. He has to think what are the pros and cons that the international agencies are talking about, and then he has to formulate his answer, right? So the same mercury question, you can make it very easy, you can make it at a little higher level, go still higher, or maybe at HOTS. Is there a need to phase out? You ask them, is there a need to phase out mercury use from dental establishments? Justify your opinion, right? So they can say yes, it needs to be, or they can say need not be. So whatever they say, they need to justify. So this goes to a much, much higher level. So it goes to the HOTS, critical thinking and thing. So, can you really now appreciate the difference in the way the question can be formulated to go by the level of your, uh, when you write your SLOs, what is the pattern that you follow when you write your SLOs? You follow taxonomy, right?
Yes. Yes, ma'am.
Whose taxonomy is it?
Bloom's taxonomy.
Bloom's taxonomy. So, based on that Bloom's taxonomy, this is the way you can keep increasing the level of your question to really test the at a higher levels of the thing. Are you all agreeing with me? The question, the way the questions can be framed to make it
Yes.
more at a higher level and more effective to judge what you want to get it from them. So the limitations that you all talked about, if you ask a question like this, write an essay on the bedside manner. So the student is thinking, which bedside manners should I write? You know, so there is a difference in the interpretation of the question that you ask. So you need to be very, very specific the way you write your questions. The other limitations, important one is that you cannot ask them too many things, limited sample of content or the syllabus. If you have got 2 essays and maybe 4 short answers or 3 short answers, short essays, the total coverage of your syllabus or the content is going to be limited. Right? Have you been talked about blueprinting?
Not yet, ma'am.
Not yet. Okay, fine. But see, this is especially when you compare it to MCQs. MCQs, the main advantage, not if you give 8 or 10 MCQs. MCQs to be really reliable and valid, what you get from MCQs, the number of MCQs as per the literature and where they have been extensively used in Western universities, the number should be, they say, minimum 100 to get complete information. So if you have 100 MCQs, then the scope of your asking questions or sampling would be much higher, isn't it, compared to your essay type of question. So it's a limited sampling that you're doing. The second limitation would be it is difficult and time consuming to mark. You all said that it takes long time to mark, and looking at the handwriting, looking at the way it has been written, sometimes the student may not be proficient in English, though he knows the subject, he may not be able to describe it properly. So that is another problem, difficult and time consuming. Then there is a lack of objectivity. Unless you give a marking key or a marking scheme, which most of the examiners look at it once and then they think that they know how to mark the answer. But most of them mark it subjectively. So there is a lack of objectivity. Again, here we are comparing them with the MCQs, whereas MCQs, you have the standard things. So you don't have to worry about, once you have checked whether the answers are correct or not, then it becomes very objective. Then there is a poor or unpolished, if the person doesn't know language properly, grammar properly, or the handwriting is not good, then it becomes a big problem for evaluating the question paper. And then there is something called as halo effect. You know what is halo effect?
No, ma'am.
No, okay. So see, you start reading question paper. Suppose you're correcting question papers as per the question numbers. You have been asked to correct only question number 1 in 100 papers, say. Now, once you start reading the first, second, third, very good answers, the fourth answer may not be so good, but it may have certain things, but it may not match with the first 3. So you are likely to give less marks to the fourth one. Or maybe if you are correcting the whole paper of one person, first 1 or 2 questions he has written very well. So you have an impression that, oh, this is a very good student. But the next question may not be written so well. He may not be able to, he may not know the correct answer. But that halo effect, the effect that, oh, he has written first 2 questions very well, is carried over when you're assessing the next question. So that is a halo effect that is seen. And sorry for the spelling. The next one is a inter-rater reliability. When the same question is assessed by 2 examiners, they may not agree upon the marks that are given. And as one of you rightly said, there is a tendency to not give full marks even if the student has written everything excellent. See, if you can you read this? Can somebody read those who have got used to reading bad handwriting?
Attached gingiva. The attached gingiva is the form of the gingiva becomes attached together. They are called as attached gingiva. In the attached gingiva, this is a typical thing where he's repeating the same thing again and
Same
again.
things again and again. This is very quite, and this is actually from a paper that has been taken. So this is one example, and this is another example. This looks like a
Chinese
writing, right? So these are some of the limitations or the problems that you see with long essays. So what are the misconceptions about the long essays? We saw what are the limitations and what are the advantages and disadvantages or limitations. So are there any misconceptions that are in our minds about the essay type of questions?
Next question.
Ma'am, we have been told that how much ever you write, you will not get full marks. So you attempt at the end of the session.
Sorry, can you repeat it? You're not very clear.
Yes, ma'am. So we were being told while when we were undergraduates that time that the long essays, if you attempt, you will not get enough marks. So don't waste your time in attempting that. You keep it for the last minutes.
Okay, that is from the student point of view. Okay.
Yes, ma'am.
Okay. From as a faculty now.
Madam, actually, while setting a question paper, not much of thought is being given by the examiner as to what exactly, because the paper setter is somebody and the evaluator is somebody else.
Okay. So paper
So,
setter is not very serious about setting up the question, you mean?
yeah. So not much of thought is, sometimes it is given to PG students or somebody else.
Okay.
And just, yeah.
Okay. Any other? So it is considered that, can I say that the misconception is that essay types are easy to construct, so anybody can do it?
Yes, yes, ma'am.
Yes. Okay. Anybody else has any thoughts on this?
Ma'am, as an evaluator, if those particular things are not highlighted,
Essay questions are the most often repeated type of question.
What do you mean by that? What exactly you mean by the repeated type of questions?
Repeated in the sense, ma'am, like if a student looks back at 5 years or 10 years of question papers, it's likely to,
Okay,
cover up.
they may be what is the misconception in that?
Not a misconception, it's a conception from the student point of view.
From students' point of view. No, we are looking at misconceptions from the. One is they're very easy to construct. That is first misconception. They are not easy to construct if you really follow the rules of the game. Questions limit guessing. Or eliminate guessing. That is another misconception, that you think that if you ask essay question, the students are going to write what you have asked. No, as we saw in the example, they can keep repeating the same answers again and again, so they're just guessing and gassing kind of thing. Essay questions are easy to score. That's another misconception. Oh, you read, you feel okay, he has written 2-3 points, so let me give 50%. It depends on the mood of the examiner also, right? If he's in a hurry, he will say, okay, 50 mark, chalo 50% de do yaar, khatam kar do, pass kar do isko. If he's in a really bad mood, he will just try to give less marks. So it's not very easy to score if you really want to do a good job of your thing. So these are some of the misconceptions about the essay type of question. So how do we improve the validity and objectivity? So you want your questions to be valid. You heard these terms in the introduction of essays, right? Introduction of assessment. Assessment should be valid, it should be reliable, it should be objective, right? So if you can formulate your essay questions, effective essay questions, what I mean by formulating is that if you can present a reasonable task to the students in the form of, say, task is equal to star into star plus 2 stars. Now, what is the first star? First star is a clearly specify the intended learning outcome by using a direct verbs. Now you all write SLOs or specific learning objectives. If you've written SLOs of the lesson, say for example, if I'm taking I'm a pharmacologist basically. So if I'm taking a class on say local anesthetics. Now, if I'm taking a class on local anesthetics, then my SLOs would be the student should be able to classify local anesthetics, and he should be able to describe the mechanism of action of local anesthetics. If these are my first two SLOs, then I can use the same SLOs to write my question, right? Say by using the directive verbs, define local anesthetics, classify them, and describe their mechanism of action. So the SLOs that you write, you can convert them easily into your questions, right? So again, so what is important is that you write your SLOs or intended learning outcomes very well. If you've written your SLOs very well, setting up a question becomes very easy. Now, when we said you need to use proper verbs. If you're setting up a question at a recall or a knowledge, just checking their knowledge level, then you can use the words like list, mention, define, name, name a few name drugs used as antihypertensives, or label this diagram and match the following, things like that. Those are the recall type of knowledge or knowledge at knowledge level of Bloom's taxonomy. Then going to a higher level of understanding or comprehension, you need to use verbs like describe, compare, interpret, distinguish between two things, maybe compute, discuss, and summarize. I would like to keep this discuss part of it for maybe PGs at a higher level, because when you talk about discussion, when you put this discuss word in the question paper, the person or the person who's writing the answers need to discuss both pros and cons, positives and negatives. So the answer becomes quite big. And so according to actually what I feel, the discuss should go into application or into HOTS. So in application, you can use the verbs like plan, practice, predict, prefer, prepare, or propose a action plan for this particular patient. You give them a X-ray of a patient with whatever complications of your tooth, and then say that you propose a treatment for it, or prescribe for a patient who is suffering from such a thing. And higher level would be analyze this or solve the problem or prepare a strategy. So these are the verbs. You need to use them carefully while writing your SLOs, and the same verbs you can use it for writing your questions. So guidelines for construction of effective essay questions is by using first is by using directive verbs, and secondly by delimiting the scope of the answer. That is very important, not just directing the, say, if you say describe the most common, so most common becomes the delimiting factor. So if I say describe the most common adverse effects of, say, morphine, or describe three uses of lignocaine. So the delimitation is that you're asking them to write only three, or maybe say most common, or you can say complications, most common complications. Those kind of things are you're delimiting your answers. So the second example would be justify why such a disease you're treating, the preferred treatment of this disease is, say, the preferred antibiotic, that justify why you would like to prescribe amoxicillin for a as a preferred antibiotic for tooth infection, something like that. So that you are adding both the components. First is clearly specifying the intended learning outcome, and secondly, you're delimiting the scope of the answer. Right? Okay. So the next guideline what you're talking about is a present a reasonable task to the students. The task can be written as a statement or as a question. When you're writing a essay question, you can either make a statement and say justify, or you can say give reasons or give your opinion, or you can ask them as a question. And then you can structure and specify the weightage for each of the section that you are giving. That's another way of constructing a good effective essay question, is that you structure the question and specify the weightage. Say for example, when you say classify local anesthetics, you are going to give them 3 marks for the classification, and you want the mechanism of action to be dealt in detail. So if you have a 9-mark essay question, you are going to give 6 marks for the description of the mechanism of action. The student knows that he has to spend more time in writing here the mechanism of action of local anesthetic, rather than just equal time spent in the writing of classification and the mechanism of action. So you structure and specify the weightage of the answer, and use several relatively short essay questions than one simple, one long one. In a long essay questions, one single long essay question also, you can do this, give them a shorter essay questions on that. Now let's review some of the essay questions. There is no group, so let's take one by one. Can somebody read the question? First question.
Mention principles of tooth preparation and discuss how to obtain retention and resistance form.
So they've
Mark is
given
3 plus 7.
7. Okay. So can you comment on the structure of the question? What level
Ma'am,
the question is?
it is structured and specify weightage for each the part of the questions.
Okay. Anything else? Is this a good question? At what level is this question set up? At recall, comprehension?
Understanding.
It's a recall and?
Level 1 and 2,
Recall and
ma'am.
understand, ma'am.
Level 1 and 2. Okay. Can this question be further refined?
Yes, ma'am. Mention the principles of food preparation and discuss the modifications in the tooth preparation of a compromised tooth, that is with a reduced crown height.
And as I just said, instead of saying discuss, you could use something else there, right?
Plan.
Yeah, you can use a plan, what would be better. How about the next question? Discuss the maxillary
major connectors for a class partial tension.
There is no delimitation factor here. So the student can go on and lose a lot of time if he tries to write it.
So it's not a structured, very well structured question. Can you improve upon this?
Design a maxillary major connector for a Kennedy's class 1 situation.
Oh, somebody else. Okay. Anybody else wants to say something?
We
Madam,
can
you were
add
saying?
a list of, yes, ma'am. We can
Yeah.
add all the list of all the major maxillary major connector and describe the design for maxillary cavities class 1 or class 2 situation.
Okay. The third question.
The impression materials writing the composition setting reaction.
Classify impression materials. Write in detail about the composition, setting reaction, and preparation of alginate hydrocolloid.
Preparation of alginate hydrocolloid doesn't seem right there.
Yes.
Is this a question to be asked in theory, or you can ask the student to do this in a practicals?
The last part could be practical, madam.
Practicals.
The
Could
rest
be
we can ask them
Demonstrate.
to write.
Just classify impression materials. Write in detail about the composition, setting, reaction, and all this can be asked in the practicals itself, isn't it? Second part of it. So what you want to ask in theory and what is the knowledge part that you want to assess here, and what is the skill that you are going to assess, that you need to decide and think. Can we now look at MDS question papers? Smile design.
It's typical of MDS question paper.
But is it a good question is my
Very bad,
question.
very bad way of asking.
Very bad way of asking. You don't know what exactly you want the student to write. MDS doesn't mean he needs to be writing anything and everything that is under the sun on smile design. Same microwaves in
Prosthodontics.
prosthodontics. Can you modify this? This you can take it as a maybe homework. Next time you can present how you could these MDS questions, how you can modify them to make them better questions.
Madam, it used to be worse before, where we used to write only one essay question for 100 marks.
100 marks. It was. So if you didn't know that, you are gone. Now even this 25 marks for each of this, and CAD and CAM, what are those? You should not be using these abbreviations in your question paper. Maybe those are the common ones used in dentistry, but in general, unless they are very well known things like, say, WHO, right? HIV, AIDS, those kind of abbreviations can be used, but try to avoid using these abbreviations in your thing. And have you all taken a screenshot of this slide? And maybe next time you can present how you will improve on these 8 questions.
Yes, ma'am.
Okay. Okay. Now, this is a checklist you need to keep in your mind when you are writing your questions. Has either phrasing of or the construction of the question been properly done? Now ask somebody else to read your question and see whether they understand the question the way that you expect the student to write. Okay. Secondly, is the question open to many interpretations? Now, when you are going to review those 8 questions, keep this checklist in front of you and see if the questions are open to many interpretations. Is the learning objective very clear in the question that you're asking? Whether the time required for answer is sufficient in relation to the marks which are allotted to the or the marks allotted are sufficient for the question that has been asked? Will they be objectively, when the answers are evaluated, objectivity when the answers are evaluated by different examiners? Or are there any other factors that you want to comment upon on this question? So keep these guidelines, checklist in front of you and try to modify those questions. So what did we learn from this activity? That there is a need to improve the question. Is there a need to improve your question the way they are set up?
Absolutely.
Yeah, absolutely. So how do we do that? So traditionally, this question asked commonly?
Yes.
Discuss dental caries. For UG, it is for 10 marks, and for PG, it is for 20 marks. Right? Was it asked like this? Any universities still ask like this? Yes, no?
No, ma'am.
And they actually break it down, define dental caries and classify different types of dental caries.
Okay. So instead of just asking discuss dental caries, they ask you to, can we improve on the validity and objectivity of this question? So we'll see different models which can use to improve upon. Yes, we can, by asking you to make instead of just asking a vague question like that, you can structure your essay questions. So what happens when you structure your essay questions? What happens if you structure? One is it improves the validity of your questions. Secondly, it facilitates the students to plan their answers if you have a structured question that has been asked. Thirdly, it decreases the inter-examiner or inter-rater reliability or variability in scoring, because if you say classified dental material or classified dental caries, there is a fixed classification. So that fixed classification, 3 marks, you should give them 3 marks. Everybody should give 3 marks if the student has written complete classification, right? So you can increase the inter-rater reliability or decrease the inter-examiner variability and enhance the objectivity and reliability of the question. So structuring is important when you're writing the questions. So recall, this is the model 1 where we said discuss the dental caries. Now the model 2 where we're talking about structuring this question. Now which is more focused model? Is model 1 or model 2 to A to E? Describe the etiology of dental caries, describe the clinical features that help in the diagnosis of dental caries, explain the characteristics of dental caries, describe one treatment method of dental caries, and list the complications of untreated dental caries. So which one is between this A to E, which is a better model?
Model 2, ma'am.
Model 2. In model 2, do you prefer A to E, anything between A to E, or all these are good one, model 2 questions?
All are good, ma'am.
All are good.
They are asking a different aspect of it.
Different aspect, yeah. So it's more structured, just instead of discuss, the student can write on any of these objects, aspects.
Yes.
Correct?
Hello, madam.
Yeah.
Yes.
Explain the characteristics of dental caries. I don't think the students would be able to the typical characteristics. Instead of that, the word can be different.
Okay.
Yeah.
Yeah,
Anybody
then
can add to that? Anybody can add to that?
What are the characteristics of dental caries?
Madam, characteristics has to be
no. What
defined.
are the
Whether it is
characteristics and
histological,
explain the
clinical, or
characteristics?
Exactly. Exactly. So you just want to see the physical changes in the tooth. What do you want to see? The actual lysis of the enamel occurring. So I think this question can be reframed, madam.
Yeah, so you can reframe in model 2, but it is better than model 1, isn't it? Just
Yes,
asking.
yes, yes, yes.
It is much better, but here also you can modify it still further. So let's look at third model. Which one of which is more focused? 2A was describe the etiology of dental caries, or you can ask why is dental caries common in Indians? Give reasons with examples. Or the second way of asking would be why is dental caries common in India amongst children? Describe the major contributory factors with examples. Which is a better one? 2A, 3-1 or
3
3-2?
3-2 is
3-2.
more structured.
Last one.
3-2 is more specific, isn't it? More thing. So the same question, instead of just describe the etiology, you can further make it more focused by asking the question in the form that is being asked: why is dental caries common in Indian children?
So, madam, we can put a question as prevalence of caries in the children
Yeah, you
in the
can put
Indias.
that. Yeah.
Yeah.
Why is the dental caries prevalent, and what are the major contributing factors for this with examples? That's then the model 4 would be, which is more focused now, model 4A or B or model C and D. Theories of dental caries. List the theories of dental caries. Describe one accepted theory, giving reasons for its acceptance. Or the way you can describe at least 3 theories of caries by their importance and justify your choice.
4AB, ma'am.
Huh? You would prefer A, B?
Yes, ma'am.
Why? Why
Ma'am,
would you
it
prefer A,
doesn't
B?
give any scope for the inter-examiner variability, ma'am. Here, it's the question in the B, in 4B is more specific. Accepted theory, reason for its acceptance. The second
Okay.
one, whereas in 4D, it is justify your choice. So it
Yeah.
becomes variable between the students and between the examiners.
Between the exams. So there isn't any fixed accepted theory for dental caries, universally accepted in India at least.
there is, madam.
There is.
Yes,
So
ma'am, there are. Yes,
there is a theory, and so the for at least 3
Madam,
theories.
when they say there are theories,
Uh,
that means each of the theories is acceptable from their viewpoint and the way they have worked. So there are multiple theories which are proposed. There is no
okay.
one accepted theory.
Okay. So you would prefer to give the first A and B type of questions, right? Describe one accepted
yes, ma'am.
theory, giving your reasons.
Madam,
Fine.
could it
Yes.
be that we use these two different models for UG and PG, where for PG,
Yes.
controversies can be, you know,
Yes. Discussed there.
yeah.
Just as a PGs, you can then justify your choice. Why? See
Yeah.
here, the describe and at least three, you're delimiting, and as well as you're giving the
Yeah. Because
active
a
verb.
PG can, even if it is not a universal accepted
Yeah.
theory, and if he still manages to justify his choice,
Yeah.
even that would be one of the things which you could assess.
Exactly. So, what you can ask for a UG and what you can ask for a PG will depend on the way you have set your questions. Exactly. Correct. And the next model of questions would be, which is more focused, model A 5AB or 5.1 and 5C 1 and 2. Say describe caries prevention. Describe two methods of caries prevention in India among children and justify your selection by giving reasons. Or you want to say describe one cost effective method each for prevention of caries in India at individual level and at community level. Your answer should have examples and reasons for the methods chosen.
Ma'am, it is
See,
5C.
5C is a better one. Why not 5AB?
Ma'am, a 580 would go for undergraduate level, whereas a C would preferably go for a postgraduate level.
Can you not give 5C also for undergraduates? Do you teach them which is more cost effective and community? What can be done at a community level? What can be done at the individual level? I thought that is covered in UG also.
yes, ma'am. It covers a wider range of
Yes, ma'am,
preventive
it
aspects.
is.
Yeah. So if you really want to check their HOTS, higher order thinking, critical thinking capacity, then maybe you can give them 5C. But if you want to make it a little less thing, maybe comprehension, or if you want to make it at a level of comprehension and understanding, maybe you can give it, because here you're just saying describe to and describe and justify the thing. So you can use depending on what level of questions you want to set up. Now, when you do your blueprint thing, no, then you are going to decide in your blueprint of the question paper as to what are the how many questions you are going to set up at what level of Bloom's taxonomy. Not all questions need be at higher levels. Not all questions need be at a recall level. Generally, when you prepare your blueprinting, you follow say 20 20 20 60 and 20 formula. So 20% of your questions could be of recall type. 60% of your questions fall into level 3 and 4 of Bloom's taxonomy, and 20% go to higher level. So based on that, then you can decide whether you want to use model 5 or you can use model 5AB or 5C. Is it clear what I'm trying to say?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes.
So does structuring improve the validity of the question? What is
Yes.
validity? Can anybody define what is validity?
Mm.
Accepted by most.
Ability to justify, ability of the question to justify its intended purpose.
Okay, so justify the intended purpose. So whether it is actually asking what
Measures
is
what
so.
it is designed to measure. How much of
Yeah,
knowledge that does each person have? Is it uniform?
Is it uniform? So that's a validity. So structuring will it improve the validity?
Yes.
Yes.
Yes. Does it facilitate students planning the answer?
Yes.
Definitely.
Yes. It decreases the inter-rater variability?
Yes, sir.
Yes, again. And enhances the
Objective.
objectivity, and so automatically increases the reliability. So if you structure your answers, you're going to increase all these things. So, madam, should I continue with SAQs, or should I stop here? We still have time, right?
Yes, we can continue, madam.
Okay.
And in case these people have some
Any
doubts to
doubt? Yeah.
clarify, yeah. So, uh, uh, do you all want to ask some few questions to madam
Any
in
questions you
assessment?
have? Any doubts? Clarifications? Or any comments on whatever we have said so far?
See, this is your opportunity. Please uh, be free.
Madam, in the early part, you told that there is going to be a limited sample for essay questions.
Yes.
So, do our students deserve a question bank from which they can prepare?
Now you are asking the
Is
two
it,
things that you are asking, two different things.
yeah, okay,
See,
ma'am.
basically, what I said by saying that when you use essay questions, sampling is limited. Now, say for example, when you're looking at uh, one of the university question papers that you talked about, two long essays, right? That means two content or two topics that you have taught can be covered up in these two long essays. Then you have uh, 4 or 5 short essays, so another 5 topics. And then these 2 mark questions, you are going to be touching on very small aspects of some of these topics, so that overall coverage of the your total syllabus is not going to be complete in when you ask long essays and short essays. Whereas if you ask MCQs, the coverage is going to be much more extensive. Not 8 or 10 MCQs. I'm talking about the actual MCQ paper of 100 marks, 100 questions, where the coverage is going to be more extensive. You can go to any depth of question when you're writing the thing. That is one. And the second part you asked about whether they can go back, and now that again depends upon the way the question paper questions have been set up. If the same examiner is going to set up the question, maybe he is likely to use the similar uh, model for asking questions. But if you have different examiners, they might use different models, as we discussed just now. Uh,
Definitely.
so that, yeah, it will help the students if they go back and look at the various type of questions, generally which are the topics which are asked in long essays and which are the ones which are asked in short essay questions. That can be that will be a guide for them to study, but that will not answer the first question of coverage. Those are the two different
And
questions
ma'am,
altogether.
during formative assessment, unless we challenge them with different types of models,
Yeah.
uh, I think we should start from the formative assessment.
Yeah, you can give them the, yeah, you can start with the formative assessment and make them understand that essay questions can or will be used for understanding their higher level of thinking and critical analysis and things like that. So yes, you can. And then once you feel that your students are comfortable, maybe when you set up your summative question papers, or when you are asked to set up summative question papers from other universities also, maybe you can use the different types of models which have been described.
Is it clear to everybody what Dr. Padiyar asked and Madam answered? Sampling is the entire syllabus. How much are you able to give justification so that you know we all aspects, important aspects the student has understood and is able to explain, interpret, and write. And also, we also asked about the formative. In fact, the formative exams is not just apart from end of the year exam or semester exam, not just two more internal or three more internal. It is continuous assessment. Of course, the continuous assessment to make it like happen how it happens as a programmatic assessment is still a far way for us. But at the same time, we can have small tests which are given to them informally so that they keep learning, because that
Yes.
is what is challenging to them.
See, at the end of your, say, one topic you have taken, you give them 10 MCQs. And then, as a formative assessment, discuss with them. Give them the feedback on those. Then it becomes a formative assessment, not just giving them an exam or giving them a test. You can call it as a formative assessment. That you know, right? The basic uh, important tenet of your formative assessment is that it should be accompanied by feedback.
So
So,
it is assessment of learning.
assessment for learning.
For learning. Whether
Formative is
they have opportunity to improvise, to improve.
improve. So, it is assessment for learning.
Mm.
So, for learning, when you say assessment for learning, then you have to give them a feedback. So, even if you conduct tests with essay questions, short essays, or MCQs, you may not be able to give individual feedback, but maybe one even after your internal assessment, one lecture class after you finish your exams, the next things you can discuss with them what are the expected answers for each of the questions. And you have already evaluated the questions, right? So you know the misconceptions some of the students have when they've answered the questions. You can address those misconceptions without naming the students. You can say that some people have misunderstood this part. Let me explain it further. Or this is what is expected from this answer and not exactly what has been answered by some of you. Like feedback can be given after your regular internal examinations also and make it more effective.
So
Right?
it's also feedback on your teaching. You can
Yes.
improvise, use other methods.
Exactly. You know that if the student, many of the students have not, I think I will stop here, stop sharing it so that it becomes easier for us to. Yeah. Yes. Yeah. Any other question?
Ma'am, how to prevent inter-examiner variability here, ma'am? Because
Okay.
it the same set of questions evaluated by one set of examiners, there's two
Okay.
examiners,
Okay.
and by another set, like going to different college.
Okay.
The student puts the same efforts, but the evaluation becomes varied. So, how to
Okay.
prevent it in the question formative stage itself?
Okay. So, formative stage, one way of avoiding inter-rater reliability is that you ask the person who sets the question paper to give the answer key. What is expected from the student for each of the question that has been asked. So, and the mark distribution also. If he has not done the mark distribution in the question, then at least in the question paper key he should give the mark distribution, so that when two examiners are correcting the papers, they should follow the question key, and then they should be able to maybe mark the answers. That is, if you are doing it for the summative assessment. For the formative assessment, one, you can create this answer key. The second way of doing would be what I was telling you about. If you have, say, 4 or 5 faculty members in the department, each faculty member will correct the same question for all, say, 40 students you have. So, faculty number 1 will correct first long essay for everybody, so that will kind of standardize the responses. There won't be any inter-rater variability in assessing that particular question, because it has been assessed by the same examiner for all 40 students, right? So these are the two different ways that you can think. Madam, you have any other suggestion?
Madam, basically what happens is, about the assessment, people are not still aware. So first and foremost, we must talk to the people in the department a common language and create that critical mass. Critical mass is people who understand and are interested in the same thing. So at least small topics like this assessment, one by one, like principles of assessment, validity, reliability. Is the question valid? Does it answer your intended question for which you asked for? Is simple validity. If it is valid, then only it will be reliable. And operator or examiner
Rater.
variability, rater variability, because we need to have a common consensus in the our department and in general in the faculty, that essay question, because I have read something new and I expect everybody to answer that, otherwise I'm not giving them marks, is not accepted.
Yeah.
Because this is a big misconception that everything I know the student should know, and everything the student knows is not enough. That's also what he does not know is not our intention to see.
Yeah,
I
the
think
intention of
today
assessment is to find out what he knows and not to find
knows,
out
yes,
what he doesn't know. Yes.
doesn't know. Yeah,
Yeah.
that's what I was coming to. So basically, I think you need to really go through what Madam has taken today and take out your question paper and at
Critical.
least make
Yes.
critically evaluate 1 or 2 papers each. Next time we want to see that how you are able to justify, or just not because everything is wrong. No, generally we don't ask the question starting with discuss. The students is a very broad term, and as Madam said, it can be asked while one-in-one on Viva or with a postgraduate, something different. And a undergraduate question, same thing, from first year to final year, a material can be asked, dental material. But it depends on what level of the understanding you are, cognitive understanding and applicability that you are giving to them. Please go through today's what Madam has done. Madam, if you can post some 1 or 2 articles on the group, they will read that.
Sure, I'll do that.
And your homework also they will do. And what I told them, to take 1 or 2 papers each
Well,
from
that
your
will
own
be
university.
on the university and
Huh.
critic, and
Yeah.
try to see how you can improve upon it, not just critic it
And
and try.
yeah, critique, improve. And if there is no need for improvement, it is already a good construct. Please don't do
Very
that.
good. Yeah, very
Yeah,
good.
yeah.
If you have a
So,
good
Madam, it
question
is,
paper, yeah, share
yeah,
that also with the group. You can
yeah,
share that in the group. You can take a question paper and say that this question is very good, this question needs improvement, and things like that. So each one of you can do that in the your group also.
yeah.
Fine. Okay.
So, anyone else has any? Sandhya, you want to ask anything? Meenakshi? Is Siddharth there?
Siddharth
Siddharth?
was not there.
I'm there, madam.
Yeah, okay.
Arepan, you never talked to me. Even initially I called you. Anand Patil is perpetually not able to attend, I think. Some problem with him.
Yes, ma'am. His mom is not keeping well. She was admitted in the
Okay.
hospital, ma'am.
Okay. But it's on my only thought is he is missing many important sessions. So
Yes,
please do share with him what
sure,
we have
sure,
done.
ma'am. Yes, ma'am.
Yeah. Meenakshi, you want to ask anything?
Ma'am, no, ma'am. I will get back to ma'am with all the homeworks done,
Yes.
and
Yes.
probably we will go in depth with the questions. But now we are getting a little more clarity. Probably till now we have made a lot of mistakes. Probably.
So we'll
we would
start
like to improve,
the
ma'am.
session. Next time we will start the session
Yes, ma'am.
with I want you to all join early at 5:45. Everyone is joining at 6:15. Please, except 4-5 people who are always there, you know. So I want you to join. Let's ask 5 minutes rapid fire round of validity, reliability, feasibility, and even other things, principles of assessment. Then what Madam talked today about the different things. And then we'll start the session. We are all geared up then. Okay?
Yes, ma'am.
Yes, ma'am.
Yeah.
Sure.
Yeah. So, Madam, then we will close the session and we'll
Sure.
see you next time. Yeah.
Next.
Thank you so much.